Let's take a quick look at an assessment for lateral elbow pain. In addition to our SOAP assessment from earlier, we're going to palpate the tendons at the lateral epicondyle of the elbow where the client complains of pain. And that's our first indicator. Where is that pain felt? Is it in the tendon? Is it in the muscle? Are you unsure? So let's get a rough idea of location on palpation. Next, we're going to look at our pain behaviour. So let's do an active contraction of those wrist extensors with the elbows flexed. We're then going to do an active resisted test. So the same movement but against resistance. And finally, we're going to stretch those wrist extensors by pronating and flexing the wrist with an extended elbow, also called a Mills test. If we produce pain on any of these movements, we need to ask our client the location and when they feel the pain. That will help us identify whether it's in the muscle or the tendon itself. So let's look at injury assessment. For example, someone who describes pain on that lateral epicondyle at the elbow. Is it tendon? Is it the elbow joint? Is it perhaps muscular into those wrist extensors? So just again, those 3 or 4 simple tests that might help you determine where the issue is for that client. So the first thing we're going to do, if we're talking laterally here, we're talking about those muscles that are going to extend the wrist and also pronate and supinate. So the first thing I'm going to do is get my client to actively produce those movements. Okay. So can you extend your wrist, bend your wrist back for me? Any pain, and where do they feel the pain? And relax. Now I'm going to bring that hand to mid-range, and now can you extend up into my hand? Any pain, and where do they feel the pain? And that where is very important. The difference between tendon and muscle, are they feeling it muscle belly, or are they going to be feeling it in the tendon itself? And then I'm also going to bring it into a stretch, so extending the elbow and flexing the wrist. Again, are you feeling pain, and where are you feeling that pain? And relax. We'll have also done our visual assessment, as we do with all of our clients when they complain of pain. Redness, swelling, heat, stickiness and cold. Any of those things, we want to look for anything unusual in the location of pain. In terms of the joint, so if we suspect or they describe pain that is deeper within the joint itself, then I would also want to move that joint through many ranges to see what's happening there. So for example, bringing the elbow into full flexion. Again, is there pain? Where is that pain? Bringing the elbow into full extension. Is there pain? Where is that pain? And then pronating fully. Any pain? Where is that pain? And supinating fully. Is there pain? And where is that pain? So just a couple of simple tests that are going to help you identify whether you're looking at a tendon, muscular or joint related issue.